Okay, hi everyone. So today's topic of discussion, it's going to be related to the current events which is going on. How to prevent COVID third wave in India. Okay, because everyone is familiar. We are again on the urge to wake up, you can say, wear the masks and all that. And how can we actually prevent it out? What are the measures you can take it? Everyone will come up with some kind of ideas. What was the COVID about? How it started? Even you can have a generic introduction of it. Okay. So in GD, Shubham, it's your first time, so I'll give you you can say some kind of a rules and regulations, how you to do a GD. First, I introduced you to a topic. That is a topic is how to prevent COVID third wave in India. Now, one of us, or you can say one of the person amongst you, will come up. He will introduce the topic. Okay, all of you will get 3 to 4 minutes. Everyone will get 3 to 4 minutes. Everyone is writing their points. Okay, whatever the points you feel that you have to speak in entire group discussion. Think about it, as much points as much you can note, you can jot those points. Clear? After that, one will come for the introduction. He will explain what is the topic about. He will give a generic introduction and his own perspective, like according to him, how you can prevent COVID third wave. Okay. Then everyone will give their own perspective. Some will agree on something, some will disagree on some things, right? And after that, when I'll say end the discussion, one of you will go for the concluding round. Clear?
Yes.
So now you have 3 minutes, 3 to 4 minutes. I'm already giving you. Just keep noting your points as much as you can. Who wants to introduce? Who wants to introduce amongst you?
Ma'am.
Okay, go ahead. It should be a good one. Okay. Introduction में I'm telling you कोई आप अपना COVID के बारे में थोड़ा brief में बता सकते हो? What was it about? How it channelized? How it is spreading again? फिर अब उसको overcome कैसे करना है? Prevent कैसे कर सकते हैं? According to you, how many people will agree with you? How many will disagree with you? हर कोई अपना अच्छे से अच्छा point दो. कैसे हम prevent करें? How to be safe again? How to make our India safer? Clear? चलो, 3 minutes for all of you. Go ahead. Okay, yeah, everyone is ready. Already given you more than 4 minutes. Okay.
Yes, ma'am.
Who is going to come for the introduction now? Ketna? Yeah, good. Ketna, go ahead.
Good afternoon, friends. I'm Ketana. I'm happy to take initiation for this topic. Today, our topic is COVID third wave. The topic is quite relevant. Firstly, I would like to speak about what is meant by COVID. COVID has occurred in 2019. It is a communicable disease, and it has affected due to the COVID virus, which was declared as a health emergency by United Nations of India in entire world. And also in our country, government of India declared it as a health emergency under National Epidemics Act. And also I would like to speak about, let's divide this topic into two dimensions: prevention and preventive things and measures. So under preventions, I would like to put few points that first of all, awareness is very important. Before facing third wave, we need to be aware of it. We need to get proper information, and we need to stay healthy. And also testing, tracing is very important. Government should be very focused on testing, and should take care of testing and tracing. And also the health infrastructure need to be enhanced by the government, because in our country we spend 1.5% of the GDP on health only. So government need to increase. So, and also hospital beds, vaccinations need to be also taken into consideration, friends. Now I would like to open the discussion.
Well, what I
Okay.
feel is that I have written some points through which we can prevent the COVID third wave. So the first point which the Ketna has mentioned, that awareness, we need to aware the people that the third wave can come. There's possibility that it can come. So from now onwards, we need to take care of it, and we need to maintain hygiene also. We need to clean our hands properly. And the other thing is that, as we all know, that most of the population has taken first and second vaccine. But the thing is that many people has not taken the booster dose. So we need to create awareness, and the government has also need to take initiative so that the people can take all the population can take the booster dose also. And the other thing is that if the government or we see any cases in any area where 5 6 cases has already detected that the COVID cases are already detected in any area, so the government can do one thing, that they can declare that area as a containment zone, so that other people cannot go there. And the other thing is that the checking also, like in airport, there should be proper authority also, like they should check the people who are coming from the other country. They should also check them, and the proper treatment should also be given in the airport only, so that it will not spread in other areas also.
Okay, I will add to the points of my friends. So I think in this COVID third wave, people are already aware that there is COVID and there are cases rising, like 10,000 cases per day recorded in the last 24 hours. So I think just because we are not seeing much cases around us, we are not taking it seriously. So that is happening actually. So to means how we can prevent it now, that at a corporate level I will talk about, at an organization level, if we earlier there used to be health drills, the awareness campaigns by the organization itself to aware their employees about the COVID impact and symptoms, that should be started again. And when the employees will get again go through these health drills in their company, again they will have the in their conscious mind, they will get these things back again, and they'll start to follow some of the rules in their family also. This is the first one of the prevention I'm thinking about. Second is that at ground levels, at the district levels, the CDMO, Chief District Medical Officer, started to identify the red zones, the crowded places where the last time most infections started, the super spreading of the virus started. They should be identified first, and then they should be monitored at regular, quite cautiously. And around them, there should be a setup again. The temporary setup of COVID checkups should have started to happen. These are the two things I'm seeing at an organizational level we could plan to prevent the COVID third wave.
I think that
now,
hmm.
go on, Ethan.
Okay, I think that the contribution of teachers and professor will also be beneficial. Like they can create awareness and teach their students also that we need to right now also we need to prevent and take precautions also.
Yeah, as we have seen that in the first phase, we were unknown about what is this COVID and what will it happen and what we have to see in future. And we were locked down. We were in lockdown. And in the second wave, we were allowed to move outside, but we have to follow the precautions and all the guidelines which the government has given. So I think the poor person has suffered a lot. We middle class and the upper class has, I think, not gone through many suffering, but the poor class has gone through many sufferings. So and now the third wave is coming, and now then also the poor will suffer, I think. So we need to prevent this, and I think we should follow the guidelines provided by the government and the World Health Organization. Whatever the guidelines this organization gives, we should follow it regularly and in a disciplined manner.
I think the people.
I think that for one of the main reason for which we can means for prevention of third wave, which we should consider is the economy in other countries. As we can see that countries like Pakistan, Sri Lanka are suffering from inflation, and so that's in that country, if the COVID spreads, it will be means the government can't tackle that situation, and if there is any means outbreak, then it can spread in our countries also. Because of the globalization, means we can't prevent it, and due to and also because of tourism, and the vaccinations which our government means which our government has are providing at COVID and Covishields, that are not much effective to the third variant, because the COVID actually mutates itself. So we have to keep that in also in consideration. So if the outbreak is spread, we should means properly manage the quarantine centers on airport and other transportation.
Shubham, I will add to your point that yes, the coronavirus mutates, and so does our immune system. Okay, so basically, a lot of our so yes, the vaccination currently is we are not seeing that it will cure it completely. But what I see that we have left a few practices which we have been doing for last 2 years. Okay, so washing our hands before touching our face was a common practice when the COVID started, but we have left it now. And there is we almost had nurtured an habit of wearing mask everywhere, but I think that is the only habit we have left it very soon. So I think these practices again at individual level can also help us to decrease the spreading of the coronavirus to much higher extent, because already our immune system has been trying to adjust itself to the mutated coronavirus. But again, these practices will surely beef them up to stop the spreading.
Friends, I would like to add one
But
point. I would like to add one point that in our India, more than 50% of the population will come under rural areas only. So I think government should focus on primary health centers mostly, because we need to control COVID from mainly rural areas only. Urban areas, they are aware of all the things. So primary health centers need to be given proper importance and proper guidance, and also sufficient amount of, that means number of doctors and nurses need to be adopted carefully there itself, I think so.
And
yes, and
Ketna,
talking
Yes,
about
I
the
would like to
Saubhagya
one point
points,
in
I
that.
would like
proper
to
and
add
adequate
one point
number
that
of lenders is also
uh,
necessary.
Okay,
so
so
let's
I will try to just add to the point of Ketana that yes, we have a great rural sector. We have to focus on primary health center. But what we have seen in the last COVID waves, that people who have comorbidities, who have COVID, it's okay. but who have other diseases like lifestyle diseases like hypertension, diabetes, they were getting very much affected. So actually, if we start, and then we have to look for those patients only, more seriously actually, because those are the first vulnerable to death first. So for them, what we can do is that we have to identify those patients at any level of healthcare, maybe at a primary level or any big hospitals. We have to identify them and we have to advise them that you should be taking more care of yours and not to go to the crowded places.
Yes,
So,
yes.
I
And
would like to
any
one point in
infection
Yes,
this.
that
and the other point is that we need to have a proper and adequate number of the cylinders also, like oxygen cylinders. And as the Ketna mentioned, that a proper number and right number of the nurses and doctors are very important also.
I would like to add one point here. Here we have seen that in first and second wave, the peoples were cured, but after medical, it can be seen that the patients who had gone to, means those who had COVID, their literally 50 to 60% lungs capacity has been decreased, and special attention should be given to these patients in future. And one point in rural sector means our government has added means medical healthcare for that doctors, but they are based on they are added on contract basis for only 2 to 3 years. Once if their tenure is over, we should also means government should look into their means for their jobs also.
Friends,
uh,
I would like to bring into your notice about the measures that we need to take. Under government side, government need to enhance their vaccine diplomacy. That means they need to maintain friendly relations with other countries, and they should take the techniques that they are going to adopt, and we can implement properly in our country. And also under scientist and doctor side, they need to sequence the genome very efficiently. Otherwise, we cannot create proper and efficient vaccine to our citizens. And also under youth, we should act as a volunteers, I think so, being a responsible citizens of our country, and we should take take duty, and we should act as a volunteers, and we should guide the people who are around us relating to this all the things and measures. And and also coming to old age and mature citizens of India, proper diet need to be maintained. It's also a major task we need to follow, because it gives some resistance powers, all the things. Millet diets, our government is also promoting millet diets recently. So I think these all the measures, I think so.
We can
and
also do one thing, that the people who has lost their loved ones and also family members, I think they should come forward, and with the help of media, they should create awareness that till now also the COVID has not gone yet. And right now also we have seen in the television that Gujarat may this much cases has increased in other state also, but still we are not taking care of the COVID precautions.
Okay,
in my
listen to
so
me
I
first.
think that
One advice keep in mind that talk about don't only focus on corporate, don't focus on the vaccines alone. Talk about different educational sectors. How can you help prevent COVID wave? How can you prevent COVID wave in the junior kids and all that? So talk about all these dimensions also. Okay, go ahead.
COVID, as ma'am mentioned, we should give introduction in at school level about the the diseases which can be spread, like as we have seen that in 1920s also plague was there, which was means millions of deaths were seen. So proper education should be given to the young generation, and the experience which we have seen.
I think that
And I think the
in the
government
age
need
group of 10 to 15 or 10 to 18, if we consider, it is, I think it will be easier for us to impart the education, because children will try learn it quickly. So we just need to have a simulation based model with them. They will just have an in the school, they can have that simulations where they will be using a mask or washing their hands, and they that should follow up. And with each class they should be given some kind of education how these get contracted, and I think that will be one of the preventive measures we can take at the junior level. And
And in the
So one
education
major,
and for the
sector,
slum
friends, the
areas,
one major government should take is that government need to invest money in the infrastructure. Like they need to invest money for the online education. Like we have seen that in the village sector, there is no proper education system right now. Also, there is lack of the school and the college. So the proper infrastructure needs to be created in this sector in the online education. Like there should be proper connectivity for the internet, and the people who are living in the village, they should have a mobile phone also. So if the third wave comes, and if uh, if again the lockdown comes, then it will not create a more problem in the students also. They can
uh,
continue their education.
so I will address to this Hetal's point that I think government has already done a lot for COVID in this last two waves. Now we have to put in our efforts at some level or other for that, because I think that for slums areas, in the slums areas or in the urban areas, I think NGOs they are present, or some social entrepreneurs, they can take a measure to educate those people and to aware them, and ensure that they follow at least some basic hygienic rules that will stop the spreading. And at our level, at the college level, or at the youth level, we knew all these things. What we can do is that we start to follow them, and uh, try to spread this around us only, try to impart this education to around us, saying that this needs to be followed, because in our age peer-to-peer learning is at its best. So if we follow a rule, others will also come up to follow that, and that will prevent this COVID third wave. COVID third wave is already here. What we can do is that we can reduce its effect.
Yes, we need to make
And
use of social media also, and also great leaders and celebrities. All these members need to take their responsibility and should make awareness of that COVID disease, and also so that every people should come to know and they can take their own responsibility rather than depending upon the government of India also.
I think
Uh,
as an engineer, we should try to see what we can contribute by ourselves. There means in COVID means some places means doctors have to risk their life. We should try to build some robotics bots, so that patients can be means helped with the help of robots.
Great point, Shubham. Actually, yes, we know that this is a very spreading disease. So yes, if we can automate, do some automations at a basic level of COVID checkups, those can be carried out by, you said, robots or humanoids, and that will be a great. But I think this might look very simple, but I think we, after lockdown, we are still living in the euphoria of traveling and visiting new places. Recently, we came to know that 30,000 people are visiting Himachal Pradesh in last 2 days. So this type of, when crowding happens at such places, the COVID gets to spread much faster. So I think at some point of time, state governments should take that they should allow a fixed number of tourists visiting some very famous places at certain point of time. That can reduce the crowd and also the spreading of this disease.
Yeah, and we should
They can
keep
also
mask.
check the passengers who are coming from the other state in the railway station or airport, and also the bus stop also.
Yes, also identifying the hotspots all over the world from where the people are coming to India at airport, and checking them and
Yes,
sending them with proper guidelines. That needs to be followed
yes,
strictly, because last time it came from outside only, and then due to our huge population, it became rampant in our country.
yes, yes. I agree with you, Sub.
Okay, so I
Yes.
think I will proceed to another dimension, try to stretch this conversation a bit. So we have covered that in kids, what we can do, and in the, let's talk about what the old age group can do. They can take care of themselves. Yes, that is one. But again, I think at those who are senior citizens, they need to follow they need to have their daily health exercises, because immune system can be built within. So because of their probability of getting infected is much higher than us, they should be following regular exercises, proper diet plan, as told by one of my friends. And also there should be regular health checkups for
Especially
those who have comorbidities also.
I would like to add few points to Saubhagya. Especially women, last time pregnant women, these people faced a lot. So government also need to consider the women, those who are facing these issues, and also the children, and also the underprivileged sections of the society. Mostly they are very vulnerable to this disease. So they need to, government need to concentrate the measures, and they need to segregate which area need to focus more. I think all this need to be taken.
Yes. I think we have
to learn up from the first and the second wave, and whatever we have done in the first wave, wrong things in the whatever we have done the wrong things in first wave and second wave, we should not repeat it again. And this will lead to the prevention of the COVID third wave in India, and simultaneously following the guidelines given by the government and checking our health regularly.
And also, friends, when we take in foreign country dimension, they are spending 10% of GDP on health, but our country is not spending more than 2%. So we should give health sector importance a lot in our country also.
Comparing developed countries with our economy will not be enough, that because we had a huge population, we are in a developing phase. Yes, I know health infrastructure in India needs a revamp, needs a lot of investment. Yes, for the underprivileged people, the slums, people living in the slum, in the rural economy, yes, government can put their efforts into that level a lot. But what I think that at some point, we who are the working class and or the private sector and the organizational level, they need to also put a part of their revenue as an ESR and into these things, just like Tata does that. Tata invest in the health programs, but other companies should come forward to do that. And because COVID is such a case that if it started to spread and lockdown happens again, then every business will be getting affected. So in that context, my view is that organizations can do much more at this point in controlling the waves and keeping their business going and not affecting the economy.
I think government should government should increase the CSR percentage for maintaining the revenue, in order to cover the revenue. I think now CSR percentage is 2% for corporate sectors. They need to, that percentage need to be increased so that government can earn the income and they can be transferred and compensated to the health sector. And also in order to encourage the people, they should give tax benefits also, those who are donating the money for emergency issues also for the citizens of India.
Another point of contention we can discuss about in this COVID wave, what we missed in the first two waves, is that when we are given medicines, when we are contracted, we are given medicines to just cure it. We used to take half of them, and after then, when we started to feel better, we leave them. That's how these virus got resistant in our body and mutated. So yes, at a individual level, we should aware ourselves and others that if we have contracted, we should follow the proper dosage of the medicine completely. Okay, then this we can cure it to some extent.
Yes,
yeah,
so
I would like to add
like
a point that we should increase the production of generic medicine, as the expenses for COVID was it's very much the middle class and lower middle class and poor, they could not afford that much money. It's literally their complete income savings were.
India is the biggest market of generic medicines in the world, and a lot of medicines are given free to the people. Yes, I agree that yes, we need to create more of medicines, but I think medicines, we are the only country who are transporting the vaccines to other countries. So I think that part is covered.
Friends,
Who wants to conclude?
ma'am, 1 point,
I
ma'am.
would,
Yeah, after your point, who wants to conclude?
I would,
Shubham,
I
you
would
want?
continue.
Okay. Ketna, complete your point and then Shubham conclude it.
Yes, ma'am. Actually, India is called pharmacy of the world. And also during COVID one wave, second wave, and first wave, we faced scarcity of medicines. So I think now government of India should bring medicines, essential medicines under Essential Commodities Act, so that prices may not be increased and demand may not. Even if demand increases, also prices will be controlled, and lower and middle class people also, they may be accessible to this kind of medicines. Okay, thank you.
Through our discussion, I have noted some of the points which I would like to conclude. Means we have seen that the risk of COVID has not gone yet. So prevention should be taken, and we should continue wash our hands and use mask in public places. And the research on COVID should be carried forward, so that if there is mutation in the COVID, our vaccine should be that much capable to overcome it. And the diplomacy with other countries should be good, so that if we are in need of help from other countries, they should come forward. And drills should be carried out in schools and hospitals, so that we should keep a track on oxygen level, oxygen cylinders and all. And the main point is, as an engineer, what we should consider, we should see how we can contribute to our healthcare society.
Okay. Now see, everyone listen one thing. When you get 3-4 minutes, now I tell you what are the things you lack, how you lack it out. When you get 3-4 minutes, की points बनाओ अपने, discussion करो, है ना? What is the thing essential is, जब आप बैठते हो पॉइंट पूरा मत लिखो, उस पर टाइम वेस्ट मत करो, ठीक है? एक आ जाता है डिफरेंट सेक्टर्स की बात करो. एक आपको मैंने बोला था एजुकेशनल सेक्टर, बीच में कोई भी नहीं आएगा बताने के लिए. आपकी डिस्कशन एक ही पैटर्न में चलती जा रही थी, वही चलती रहनी थी. आप एजुकेशनल सेक्टर में कर सकते हो, मीडिया कैसे हेल्प कर सकता है, मीडिया अवेयरनेस पे हेल्प कर सकता है, ठीक है? आपके हेल्थ सेक्टर है वो कैसे, ही शुड बी रेडी, हेल्थ सेक्टर के पास पहले इतना रेडी होना चाहिए. हॉस्पिटल्स उसमें आ जाते हैं, उसके पास आपकी मेडिकल फैसिलिटीज, जैसे केतना ने लास्ट मेंशन किया पॉइंट, केतना दैट वाज अ वंडरफुल पॉइंट यू कोड, तो वो आप पहले मेंशन कर सकते थे, उसको डायमेंशन बना के. हेल्थ सेक्टर था ये, कुछ भी आ गया. उसके बाद स्टॉक के लिए हमें रेडी होना पड़ेगा. कल जैसे हम ऑनलाइन सोर्सेज या उस दिन मैं आपसे बात कर रही थी कि इज इंडिया रेडी फॉर 5G एंड ऑल दैट, तो क्या था एक क्वेश्चन उसमें ये था ना कि इंडिया को रेडी होना पड़ेगा 5G के लिए, पहले हमें रेडी मार्केट रेडी होना पड़ेगा, ठीक है? तो क्या हेल्थ सेक्टर वाला जो मार्केट है या हॉस्पिटल्स है वो रेडी है इन केस दोबारा प्रॉब्लम आती है? हम प्रॉब्लम तो नहीं होगी फंडिंग में या किसी चीज में, ये ना हमारी इकोनॉमी पूरी डाउन हो जाए. हमें इकोनॉमी का भी सोचना है कि कैसे अगर ऑनलाइन सब कुछ हो जाएगा ऑन स्पॉट, इफ टुमारो एवरीथिंग टर्न्स ऑनलाइन, विल यू बी एबल टू सेव अवर इकोनॉमी ऑफ इंडिया? उसमें किसी ने बात नहीं की. वैक्सीन की सप्लाई के लिए हमें पहले ही रेडी होना पड़ेगा, स्टॉक हमें कुछ ना कुछ इकट्ठे करके रखने चाहिए, बिकॉज अभी कोविड केसेस कुछ ना कुछ अराइज हो रहे हैं, तो यू शुड बी रेडी. मास्क डालना या फिर अपने हैंड वॉश करना, या ये तो आपको नेचुरल गाइडलाइंस मिली थी. वन कुड हैव डिस्कस्ड ऑल द गाइडलाइंस कि वी शुड बी अवेयर विद द गाइडलाइंस जो पहले चलती आ रही थी, वही हम दोबारा से चैनलाइज करना अभी से स्टार्ट करते हैं. प्रिवेंशन इज बेटर देन क्योर, तो हाउ यू कैन प्रिवेंट इट आउट, वो डिस्कशन नहीं किया, प्रॉपर नहीं किया किसी ने, ठीक है? यहाँ पे गाइडलाइंस की बात आई थिंक जयेंद्र ने स्टार्ट की थी, फॉलो गाइडलाइंस एंड ऑल दैट. Jayendra told, Jayendra, you could expand that point. Okay, what kind of a guidelines you were following, and now I think we should all be wearing masks right now also, so that it should not proceed to negativity. वो चीज को आप थोड़ा सा ध्यान रखें. या other person could agree and disagree. Okay, उसके बाद pregnant ladies, old people and children, ये 3 कैटेगरीज होती हैं एडल्ट्स या यूथ को छोड़ के, जो बहुत ज्यादा बोल सकते हो सिवियर अंडर एक्ट पे आ जाती है. उनके लिए क्या क्या प्रोसीजर्स हो सकता है, उनके लिए क्या क्या डायमेंशंस हो सकती है, वो डिस्कस करना. ये सारी कुछ चीजें होती है जब आपको डिस्कशन का मिलता है ना, 3-4 मिनट मिलते हैं, तो ऐसे टॉपिक सोच लिया करो कि किस किस में मेरे पॉइंट्स बन सकते हैं, एंड यू विल नेवर लैक पॉइंट्स. अभी ये सबने, अभी बहुत चीजें आपने, न्यूज मीडिया का किसने डिस्कस किया? अवेयरनेस में सबसे बड़ा रोल किसका होता है? मीडिया का ही होता है. और किसका होता है? न्यूज़पेपर्स का होता है. और किस चीज का होता है? या फिर एजुकेशन इंस्टीट्यूशंस का होता है. बच्चों को स्कूल में ही गाइडेंस मिली जाए, ठीक है? उनकी ऑनलाइन क्लासेस अभी से हम स्टार्ट कर सकते हैं, कुछ ऐसा चैनलाइज में कर सकते हैं, एजुकेशन सफर ना हो, इकोनॉमी सफर ना हो. नाउ वन थिंग, सौभाग्य, व्हेन वी कंटिन्यू सम टॉपिक एंड कंटिन्यू सम पॉइंट, ये कभी नहीं बोलना फॉर कंटिन्यूशन आई एम गोइंग टू टेल अनदर डायमेंशन, ठीक है? That should not be. It should be like, I want to bring new dimension to you. I want to bring a point to you. I think our discussion is missing this. तो वो बोल सकते हो. ये नहीं बोलना कि continuity के लिए हम ये बोल देते हैं, continuity के लिए. वो negative sound करता है कि सिर्फ बढ़ाने के लिए, बात को बढ़ाने के लिए कर रहे हैं. अभी आप कम लोग थे आज, तो आपको हर एक को बोलने का मौका मिल रहा था. Still, Jayendra could give less points, Hetal could give less points. Why? What was the reason? आज तो easy था topic. आज क्यों हेतल कम थे?
मैम पॉइंट तो इतने याद आते थे.
इतने याद आ रहे थे? अभी ये सारी चीजें मेंशन की थी जो मैं बोली अभी?
नो मैम.
क्यों? जयेंद्र, व्हाट वाज द रीजन? स्टार्टिंग में गाइडलाइंस देके फिर भाग जाते हो, फिर आ जाते हो. व्हाट कैन बी द रीजन? पॉइंट्स नहीं आते अभी?
यस मैम, पॉइंट्स नहीं आते.
जितना ब्रेनस्टॉर्म कर सकते हो अपने आप को, तभी मैं बोल रही हूँ अपने आप को ये सोचो, जितना ब्रेनस्टॉर्मिंग कर सकते हैं, किस किस सेक्टर में हमें अवेयरनेस, कोविड पे हुआ था, किस किस पे इम्पैक्ट पड़ा था, गरीबों पे कितना इम्पैक्ट पड़ा था, उनको वापस अपनी शिफ्टिंग करनी पड़ी थी, ओल्ड यू कैन से पुअर पीपल पे इम्पैक्ट पड़ा था, इकोनॉमी सफर करी थी. tourism, yeah, I missed that point, like tourism. Even I am writing the points that I even noted down कि मैं कहीं से चेक करके नहीं बोल रही हूँ. Think about it, brainstorm it out. tourism पे इम्पैक्ट पड़ा था, टूरिज्म के कारण ही इकोनॉमी गिर गई थी, और किस चीजों पे हुआ था?
श्रीलंका एग्जांपल टूरिज्म सेक्टर में.
या उस पे आप ये भी कर सकते थे. इवन कुछ शॉप्स ही सर्वाइव, कौन सी खोल सकते थे हम? आई थिंक इट वाज ओनली केमिस्ट्री शॉप, या फिर आई थिंक वन वाज योर ग्रोसरी शॉप्स, दैट वर ओनली ओपन. रेस्ट वर ऑल मार्केट वाज क्लोज. तो मार्केट कैसे इम्पैक्ट हो सकता है, मार्केट को कैसे बचा सकते हैं हम? ठीक है, हाउ द इकोनॉमी विल, अब दोबारा से इकोनॉमी अगर वो चली जाएगी, बूंद में चली जाएगी, या बेन में चली जाएगी, तो हाउ वी विल सर्वाइव? वो तो पुराने लोग सफर करेंगे. उस पर डिस्कशन करनी चाहिए थी. हाउ कैन वी बी रेडी? हम इंडिया को कैसे सेव कर सकते हैं कोविड थर्ड वेव से? वो कोविड थर्ड वेव है, मतलब गिरे ना. वो अकेला ये डायमेंशन नहीं है, हम कोविड से कैसे बचे. इसमें हर सेक्टर इंक्लूड होता है. एजुकेशन होता है, जॉब अपॉर्चुनिटीज वाला होता है. जॉब्स भी पैक हो गई, कितने ले ऑफ हुए थे, वो कैसे बच सकते हैं? हाउ कैन वी थिंक अबाउट इट? उस डायमेंशन पे सोचो. हेल्थ सेक्टर रेडी नहीं था. वो क्या बोल रहे थे डॉक्टर्स? बोल रहे थे हम तो स्ट्राइक पे, हमें हमसे काम नहीं हो रहा है, और डॉक्टर्स को पॉइंट करो, है ना, या डॉक्टर्स लीव कर रहे थे, कोविड में हम ड्यूटी नहीं देंगे. ये चीजें पे मास्क की कमी हो रही थी, सैनिटाइजर में. ये पॉइंट अच्छा था जो कितना यू मेंशन्ड अबाउट इट कि हाँ मेडिसिन को अंडर एसेंशियल एक्ट को लेकर आना चाहिए ताकि उनका बजट वगैरह फ्रेंडली हो सके, राइट. उसमें आपका शुभम योर पॉइंट दैट लार्ज कैपेसिटी डिक्रीज एंड ऑल दैट वाज गुड. सौभाग्य इन लास्ट कोविड वेव क्या क्या आपने आइडेंटिफाई किया था, वो अच्छा था. तो कुछ कुछ पॉइंट्स सबके अच्छे थे. आई डोंट से कि इसमें बोल नहीं पाए, पर इसमें ये था कि बहुत फ्रूटफुल, आप बहुत पॉइंट्स अभी लैक कर गए. You lacked various good points which you could mention, and this is like something topic. जैसे मैंने बोला, India ready for 5G, is India ready for this COVID wave 3, can we fight COVID wave 3 back and all that. ये आ सकता है. कोविड पे बहुत डिस्कशन चल रही है अभी तक, ये बन भी सकता है. ठीक है, और इसमें आप लोग की यूथ की अवेयरनेस सबसे ज्यादा नीडेड है. ये मत करो, पॉइंट्स अच्छे सोचा करो, डिस्कशन लाओ. हेतल, जयेंद्र, यू आर लैकिंग गुड पॉइंट्स राइट नाउ. डिस्कशन में आते हो, फिर चले जाते हो, वैनिश हो जाते हो. This won't work in good way. ठीक है, कितना the points were average, not good. The capacity you have, they were very average. At the last, I liked your point. That was a wonderful one from me. Okay.
I mentioned education, health sector, economy also, no ma'am.
जी मैं डिस्कस सबने किया है. अब मैंने बोला गाइडलाइंस पे जयेंद्र ने भी डिस्कस किया. एक हाईलाइट वाला पॉइंट है, दैट वाज गुड ऑफ योर्स, ओनली वन व्हिच आई लाइक द मोस्ट. ठीक है, रेस्ट इट वाज ऑल एवरेज. सौभाग्य का कल ज्यादा बेटर था, आज एवरेज था. It was not that good. ठीक है, maybe he lacked pointers and not that. सौभाग्य क्यों आज पॉइंट्स अच्छे नहीं याद आ रहे थे?
I tried in this type organizational level, individual level, but हाँ मतलब the sectors that are getting affected by COVID, I was not into that. I was thinking about that COVID third wave में हमने क्या मिस्टेक किया, हमने उसको कैसे ठीक करना है.
एक काम करा करो, जब आप करते हो ना 3-4 मिनट्स में नोट डाउन करते हो पॉइंट्स, हर तरह के बना के रख दे करो. कि कोई सपोज करो आज आप कम थे, कईयों ने पॉइंट्स बोल दिए होते तो आपके पास लैक हो जाते. आप तो बोल ही नहीं पाते. ये हेतल और जेंद्र जितना बोला वो भी नहीं बोल पाते. ठीक है, तो ये मत करा करो. डिफरेंट सोच लिया करो कि मैं क्या ब्रेनस्टॉर्म जितना भी लिख सकता हूँ ना एक पेज पे. आई टेल यू वन हैक, व्हेन आई यूज्ड टू गिव माय एग्जामिनेशंस लाइक फॉर यूनिवर्सिटी आल्सो, क्वेश्चंस आते थे ना, पहले क्वेश्चन मिलते थे, वी गेट अ क्वेश्चन पेपर. व्हाट वी यूज्ड टू डू इज हम पहले पॉइंटर बना लेते थे. लास्ट शीट आई हैव केप्ट फॉर पॉइंटर्स, दैट्स इट. कि व्हेन आई राइट इट आउट आई नेवर लैक ऑफ आइडियाज. बिकॉज व्हाट वी डू इज जब हम बोलना शुरू करते हैं, लिखना शुरू करते हैं ना, वी आर इनटू अ डिस्कशन, हम उसी में घुस जाते हैं, हम बाकी पॉइंटर सब भूल जाते हैं. और बाद में एंड ऑफ डिस्कशन पे याद आता है मैं ये भी बोल सकता था, ये पॉइंट अच्छा था, मैं कैसे मिस कर गया. ठीक है, तो जैसे ही वो 3-4 मिनट मिलते हैं ना, क्लोज योर आइज, डू एवरीथिंग एल्स, किसी का नहीं सुनना, सिर्फ नोट करना है. ठीक है, ट्राई योर बेस्ट. शुभम, इट वाज योर फर्स्ट वन, इट वाज गुड. Okay, you have a capacity to improve, attend the regular the GDs and all that. Okay, that will work. Fine. Chalo. All the best, everyone.
Ma'am,
Yeah,
ma'am, about your HR interview slot for your means from your side at 4 p.m. should I join?
Yeah, 4 p.m. you can get the slots.
Yes, ma'am.
Okay.
I also want to learn.
Ma'am, once please give for group task also, ma'am. Arrange group task also, ma'am.
Group task, I think I'll ask Vijender sir. He might arrange one for you. Okay, GDs I'm taking. Okay.
You also take one group task, ma'am.
Okay, I'll also take one group task. Okay.
Yes, ma'am.
Okay. All the best. Bye bye. Take care.